The next one we are going to talk about is endometrial abnormalities. Abnormal bleeding (AUB) is term that describe abnormal flow in a woman of reproductive age. AUB can be related to abnormal volume, duration, frequency and regularity of menstrual flow. Evaluation of women with AUB is beyond the scope of textbook, but in general should include the history, the physical examination, laboratory and imaging, and endometrial sampling when indicated, based upon the age of symptomatic women. This is insufficient evidence to recommend the use of transvaginal ultrasound for endometrial thickness evaluation in AUB in women of reproductive age unless they are at risk for endometrial carcinoma. Transvaginal ultrasound is very useful, however, as a screening test to assess the endometrial cavity for fibroid and polyp, endometrial polyp and submucosal leiomyoma. Common focal intracavitary endometrial lesions include polyp and submucosal leiomyoma as account for 30% and 10% causes of post-menopausal bleeding respectively. This image below is showing the endometrial polyp within the endometrial cavity, and you see the little blood flow interrogation on Doppler. Differentiating sonographic features of endometrial polyp and submucosal leiomyoma. Polyps are contained within the endometrial cavity where leiomyoma extends to the myometrium. Echogenicity of the polyp is similar to the endometrium lining, where echogenicity of leiomyoma is similar to the myometrium. Polyps tend to have a visible vascular peduncle on color Doppler and homogeneous in echo texture. Leiomyoma leave the endometrial lining. Also, leiomyoma tend to show on ultrasound beam. Endometrial adhesion and retained product of conception. Other endometrial pathology amenable to diagnose by sonohysterographic include intrauterine adhesion and retained product of conception. Intrauterine adhesion is clearly visible on sonohysterographic as a thick or thin echogenic bands that attach to the endometrial wall. Sonohysterographic is the best imaging modality for the detection of the intrauterine adhesion and should be considered in a patient with prior intrauterine instrumentation. Retained product of conception appear as an echogenic mass within the endometrial cavity. They are typically seen in women following an abortion, miscarriage, or a delivery. These are the three images showing on the screen. On the left side is showing the endometrial adhesion, a cystic with septation within the endometrial cavity, and on the left side too is showing the adhesion of the cyst within the endometrial cavity. On the right down side is showing the retained product of conception by brightened echogenic mass within the endometrial cavity.